Oh, so should I repeat everything I said?
Yes, yeah, why don't you?
I apologize, I didn't
Well,
even
let's
know.
start with this. Good morning, Kathy.
Good morning, Mr. Chair and Commissioners. And that ends my report. Thank you very much.
All right.
Sorry. Okay, so the numbers, as it shows on the graph from the handout, it shows that the numbers are leveling off. Our total cases are 6,343. So we have 174 active cases, and that number is even down since the 6th. So I think the numbers are under 100 now for active cases. And our case investigators and contact tracers are still working through the cases, but the numbers are down, so there's less time putting into those cases. So that's all good. All of the measures that we talk about, the masking and social distancing, clearly are helping keep our numbers low, because we don't see that across the country. There's some states that are really seeing surges. We also know that our hospitals, Ascension, Sanford, are managing quite well, and they're not seeing unmanageable numbers for patients admitted to ICU or the hospital. So that's really good too. We look at the hospital situation and make sure that they're not overwhelmed, and they are not as of the last report. 78 deaths, so we've had 78 since December 23rd, so no additional deaths at this reporting period. You know, we don't like to see any deaths, but we have maintained no deaths since that December 23rd, where we were jumped up to 78. The cumulative cases for Minnesota is a bit over 437,000, and they have 5,711 deaths, 5,711. And then, of course, our hospitalizations are all across the state of Minnesota. Their cumulative positive rate is fairly close to the same, so 7.6%. So those numbers are, again, we're happy to see that we are not surging up, so that's really good. And then if we go to the third page, because Jamie's going to be talking about the vaccine administration in just a minute, but the third page shows the ages again of our active cases, our cumulative, cases. You see the difference, and now active cases are really the 40 to 44 are our top, and then the 20 to 24, but they're really kind of all around that age category. When we talk about our active cases, initially when COVID started, it was really hitting long-term care facilities, but that's less of the impact at this time and more of the impact on that middle age category from our 20s to 49, so in that range. So it's a bit all over the age range in that spectrum.
Kathy, is this graph on the age of active cases, is that comparative to the 174 number on the front page?
Yes.
So they kind of correlate together?
Correct.
Okay.
Yes, that's correct.
Thank you.
And then the Cass County numbers, they're also doing pretty well with their cases as well. So they have 388 active cases, a total of 20,418. That's in Cass County, and then the 177 deaths. So their cases are also more manageable than they were previously. So they're seeing that decline in cases also. So we're really doing pretty well in the number of, mainly the number of positive cases we're following, and also the hospitalizations. It's really a big deal to manage that our hospitals are managing those cases, and we're not seeing the big influx. So things are going pretty well at this point in time. So we're happy to see those numbers. And then I'll have Jamie talk about the vaccine distribution.
Before you do that,
Oh, sure.
Commissioner Mojo has a question for you.
Thank you. For the public's perspective, we get these packets every single week on the numbers, and so I appreciate that, because we've asked you to bring that together so that it was easier to track and understand. And from the public's perspective, I think it's important that they know that this pause in deaths that we've had is something that we haven't seen since September. And the actions that we have, as a community, have taken to keep each other safe is really working in terms of preventing deaths and keeping the hospitals at a manageable level. And I think that's an important milestone, a sad, grim milestone, but one that's important that the public know that even though there are some serious cases out there, we did see a little bit of a pause in deaths.
Yes, thank you, Commissioner Mojo. That is absolutely good to recognize.
Amy, good morning.
I'll talk a little bit about vaccine distribution and administration in Minnesota. As Kathy pointed out, we have been busy vaccinating, and I will say not busy enough. So we, of course, would like, knowing that there's a national shortage of vaccine, we would like to see more flowing. We have two teams that are working. One is the planning team and one is the administration team. And the planning team has been very busy training staff, training student nurses in the community, and they're ready to go. And so we are prepared to vaccinate as much as we can get vaccine. In Minnesota, basically, there have been 147,645 doses. In Clay County, there has been 918 doses administered, and that is updated weekly, so that'll update again on Thursday. Clay County Public Health last week vaccinated 500 people. And so we are bumping that number up, and we do have plans for another clinic this week to use the vaccine that we will have on, the vaccine that came in this week or will come in this week. And that's just short of 200 doses that we will be using this week. Just basically from a perspective for thinking about Clay County, vaccine is coming to us in 3 different ways in the communities. One is through hospitals, and we don't have a hospital in Clay County, so that vaccine is not coming into our community. The other is through the pharmacy program, and we have a very large number of residents living in long-term care in Clay County and assisted living facilities, and they are in the process of being vaccinated by the pharmacy programs. Now, that's a federal route that the vaccine is coming, so it's coming directly to the pharmacies at the federal level. So it's not included in the doses that are listed on the Minnesota Department of Health website when they're talking about how much is coming into them. That's a separate piece, so that's huge, and that's good news. The news that I have to share today is that 3 of our 4 long-term care facilities and nursing homes have been vaccinated. The 4th we just haven't heard back from yet. Our assisted living facilities, we have one that's planning, a large one that's planning to receive vaccine, and again, we try to communicate with them on a regular basis to get those updates, but it's starting to roll for them as well. The phases that we've been focused on in Minnesota is, I'm sorry.
Jamie, so you said the first one was hospitals and the second one was pharmacies. What's the third one?
Public health, sorry. Okay. And so those are the 3 tracks that vaccine is coming through. We've talked about vaccine is charged with vaccinating at this point EMS providers that are not affiliated with a healthcare system, and also with the vaccine testers and any healthcare providers that are not affiliated with the healthcare system, like a standalone clinic, and then also the vaccinators, COVID testers and vaccinators. So that's what we've been focusing on in phase 1A, and that's the first priority, so we continue to address that. Last week we did have some vaccine, and we didn't have enough of those groups signed up, so we moved into priority 2 and 3 as we could to get the vaccine used up by the end of the week. So this priority is back to phase 1A, priority 1, so we are, it's our first responders and our testers and vaccinators that are scheduled to vaccinate this week. The way the process works is that we actually send them out an invitation. So if you're an employee, that invitation comes to you through your employer. So that's who we're reaching out to, saying how many employees do you have that are healthcare providers or first responders that are in that face-to-face. So we're focusing on healthcare providers and face-to-face contact right now. And so we send them the link. They register through our electronic system, PrepMod, that we're using for the state of Minnesota to vaccinate.
Just a question. Public safety, law enforcement, and firefighters, are they part of this group, and have they been reached out to?
Our first priority was EMS, so, that was, that's what we focused on last week, and we did push that out. That's what I said, we didn't get enough registered, so we moved on. Law enforcement was moved into that priority area at the end of last week, so that's a lot of who we have scheduled for this week.
Yeah, statistically, it's the largest killer of police officers and deputies last year on in line of duty deaths. And it really is something that needs to be addressed.
And it is. It's a priority. It needed to come through the state. We realized that law enforcement is often first at the scene and responding, and so that just needed to, that direction needed to come through the state, and it has. So we're moving forward on that. So basically, the planning that's going on between state and local public health is at, the corrections level, the homeless shelter level, the universities, the schools. All of that planning is happening on a weekly basis to figure out when will we do them. So as we're talking about, we have to get the okay from the state to move to the next group, we are already prepared because we're planning, we're getting numbers, and deciding what would be the best venue for us to administer that vaccine.
Jamie, is the 918 number, those are public health vaccinations?
That is actually, it would be anyone that the vaccine came from the state and was administered in Clay County. So it could be our nursing homes, it
Oh,
could be our
okay.
assisted livings,
Okay, pharmacies?
yes,
Okay.
and us. So we know that number's low because it
Yeah.
updates weekly, and so we're waiting for it to increase. But we know we contributed 500 of those.
So we have several citizens in Clay County that work for Essentia or Sanford, and they're receiving that vaccine, but they would not be included in these numbers, would they?
Right.
So in terms of the hospitals, even though we don't have hospitals in Clay County, we have, a significant number of our citizens work there, and they are getting the vaccination through that process.
Yes, as well
I
as,
know several of them already have, and
Yes.
we're thankful for that, but,
as well as our clinics that are affiliated with them, but
Yes.
yet located in Clay County. So,
Okay.
so that's a very large number of healthcare.
yeah, and so they're not included in that 98.
They're not included in that number.
And Mr. Chair and Commissioners, we did put a request in because we're getting kind of small amounts, and we have the capacity to vaccinate many more. So we put a request in for larger amounts of vaccine, and so we'll see. We get shipments every week. It comes through the federal government, and then the Minnesota Department of Health kind of vets that out. So we are hoping to get a lot more shipment because we have the ability to provide more.
And I do want to say that personally, I get information on my chart, and they kind of keep me up to date in terms of where I stand in their process.
Sanford, my chart.
Yes, yeah, and this happens to be Sanford. I wasn't going to promote one.
I think my chart, people don't know what.
Oh, yeah. So it's so I do get updates on, and I think they take several factors into consideration too on where you're going to be in line for their shots too.
Sure.
And that's an important point, because the calls that are coming through our office, we're talking about if you're an employee, you'll be notified by your employer, but if you're a citizen, you'll be notified by your healthcare provider, and so I think that's what you're talking about.
Right.
You're pushing that out to the public too,
Yeah.
saying, we will be in touch with you when you're ready for your group.
Well, and I think they're probably overwhelmed with calls too about
Yes.
when can I get it, so I think they're kind of stay ahead of it by doing those messages, which I think is good. So.
Right.
Can I ask a quick question too? So for citizens that don't have a regular healthcare provider, how will they find out when they can be vaccinated?
That's a really good question, and what we've seen with flu clinics in the past is that the healthcare providers will do blitzes and say you don't have to be a client of ours, that you can hold a clinic. Otherwise, if they don't have a clinic, public health would be responsible for them.
And Mr. Chair and Commissioner Cayley, we will eventually be opening up what we call mass dispensing. So it'll be open to the general population. So when we get to that place where MDH allows us to open up a mass dispensing, then citizens will be able to go there as well.
Excellent, thank you.
So places like Churches United and how are they considered in a phase or?
They are, and they're a high-risk priority because of
Right.
the congregate living setting, and so
Right.
they are in Phase 1, Priority 3. And we had a conversation with them in the State Health Department yesterday and doing some planning for that group as well.
Because, I mean, that could also be a real source of spreading if it's,
And Commissioner Chair, we also need to work with, when we talk about homeless individuals or people experiencing homelessness in facilities like that, we really want to work across the metro area. So we have someone on our staff that will be working with someone in Fargo-Cass Public Health. So because we know these individuals sometimes cross over. And so to find them to get even a second dose is going to be a challenge. So we're going to work kind of across the metro for all the homeless population.
okay. Anything else, Jamie, on the vaccines?
Yeah, well, question. If you take the first one and don't take the second one, is it still effective or not as effective?
Less effective, just like our childhood immunizations, they have a series because that's how you get to boost your immunity to the appropriate level. So you're not going to be adequately covered with that first vaccine.
Okay.
It's kind of like taking part of your antibiotics and not finishing it.
Yeah, you only have a much lower percentage of immunity. So to get to that 95%, you need the second dose.
Okay.
Any other questions from the board? Steve, any questions? All right, thank you.
Thank you.
Thank you for your time.
Good report.
work.